drug news that's come through in the last few days, which I think we do need to share with you in case you are on some of these prescription medications. For example, some of the world's most common drugs for hypertension or high blood pressure significantly increase the risk of skin cancer. And they're known as diuretics or water pills, increase the risk sevenfold, which is an enormous increased risk. And so for people who are taking diuretics, they actually do need to be careful being out in the sun, as it will could have quite a profound effect. Normally the safe sun idea is overblown and is based upon sun exposure in Australia, and for northern climes it doesn't make a lot of sense. But if you are taking a diuretic, it is something you probably do need to take seriously, or talk to your doctor about taking another antihypertensive. There's another drug alert that came out a few days ago about a commonly prescribed diabetic drug called metformin, which again is causing a whole series of serious side effects. And in fact, usually gastric problems, nausea, diarrhea, vomiting, and around about a third of people can't tolerate the drugs. So I think again people need to be aware of that and probably need to talk to their doctors about whether they should continue treatment. I mean, if you have suddenly started to develop gastrointestinal problems, and it also so happens you've just recently started taking the drug, it's not unreasonable to suspect the drug actually is the cause. So that's that.
Well, and I think what's so outrageous about these latest stories is that they both concern a condition that can easily be handled by the judicious use of diet and exercise and supplements. Let's just take blood pressure, for instance. One of the really outrageous things about blood pressure is that the doctors keep changing the goalposts as to what is considered high blood pressure. Currently, it's at its lowest level. So that means more and more people are considered to be hypertensive when they're not. I think it's something like 120 is the threshold, which is just outrageous because that puts so many millions of more people into the whole category of being someone with high blood pressure. But there are many, many things. I mean, you easily can sort your blood pressure simply by eliminating sugar from your diet. And by sugar, I mean all the white stuff, anything that comes in a box, anything that's been processed. And most of that will go a long way toward lowering your blood pressure. I mean, as it happens in our February issue, an upcoming issue, we're going to be covering a whole bunch of stuff about blood pressure and how you can lower your blood pressure naturally with certain supplements, with a number of different things like that. Now, the same goes for type 2 diabetes. This is also scandalous that drugs are being offered for type 2 diabetes, which can, in the main, be completely controlled by changing diet. People who go on to a low glycemic diet, that means they avoid those foods that turn into sugar quickly, like white rice and bread and white potatoes and things like that, can quickly normalize, or adopting a paleo diet, which is becoming more and more popular, where you eliminate the white stuff plus grains. People normalize their blood sugar and get it under control very easily without having to take a potentially dangerous drug.